what has that done to the resources you've had available? Because I imagine that puts incredible strain on the people, the dollars, the funds that you have to support these programs. Maybe you could talk to that for a second.
We've seen our referrals go up 200%. I'm going to be honest with you. Everybody is at their breaking point. Everybody in healthcare is at their breaking point. I mean, that, when you talk about that, you talk about a lot of the acute care workers who, they were putting themselves directly in harm's way, their family in harm's way for months to take care of people who, were coronavirus positive, people who were volunteering to work in, conjunction with those patients that normally wouldn't be in those settings. And then, you kind of have mental health who's over here just sort of quietly plodding along, and it's not the same kind of risk as, like the people who work in med surge and the people who work in ICU and things like that. But there's almost a secondhand trauma. So it's almost like a survivor's guilt because you're not up there working directly with it. And then on top of that, then you get hit with the backwash of, these just huge numbers of patients and I think that people forget that, healthcare providers are people too. We're struggling with the same things everybody else is in the pandemic. And on top of that, our jobs have now been made exponentially harder and there's no end in sight. I think every week, Lindsay will laugh. Every week I try to give a little bit of hope. Oh, maybe we'll get another provider or maybe it'll slow down or the vaccines, look at our vaccine rate. And then every week we get more and more referrals. And so it's like, nope, no, it's just more dirt. Just keep shoveling. It's great. At this point, it's
You
easier
know,
to just dig down than it is to dig up.